Think of your life as a giant puzzle, filled with unique pieces that need to be put together in order to feel complete.
Push, push.
For the nearly 9,000 children living with autism in Nevada, life is like a puzzle, and finding the right pieces, the right services, can be a fight against time.
There are wait lists for everything.
Time is a battleground for moms like Brooke O'Gara.
So that's an 18-month waiting list that we've been on just to get help.
And Angelia Belinsky.
I think that's the hardest part, because you want to get help for your kids.
Both caught in the middle of a desperate need for providers and therapists to work with children living with autism.
Okay.
Excellent.
We were really short. We were short speech therapists, occupational therapists, and especially ABA therapists.
Dr. Mario Gaspar de Alba, a developmental behavioral pediatrician, agrees the shortage of medical professionals is a missing piece to the puzzle that's also affecting him.
I can't see a lot of kids per day because each kid takes quite a bit of time.
Cases of autism have risen over the years in the United States. According to the Centers for Disease Control and Prevention, about 1 in 59 children are diagnosed with the condition.
We don't have enough people to help make the diagnoses.
Patrick Latham, a board-certified behavior analyst and associate professor at Touro University, says early diagnosis and early intervention is key, and that means getting timely help.
Now we only have about 193 who are licensed to supervise and oversee the treatment for kids with autism from a medical perspective.
Dr. Gaspar de Alba says treatment often requires more than one professional.
Sometimes they don't just see me. A lot of times they need to see a neuropsychologist, and often they need to see us both.
When I feel helpless.
It has taken Brooke's son, Jimmy, more than a year to get therapy.
Just feeling it's not fair.
Grant a Gith Autism Foundation is picking up some of the pieces, making it their goal to raise money, helping families with treatment options, and trying to bring more providers into our community.
We really do have to make that the focus every day, and it might depend on each day of what that next resource might be.
Someone did this, what does it mean?
Good job.
Angelia is starting to see change in her son Maxwell, who is finally getting therapy.
It's really helped us, especially as a family.
Both mothers are determined to stay positive. They're hopeful other families living with autism will join forces and start seeing the pieces come together. Renee Santos, News 3.
And the Dr. Renee Story says Nevada ranks 4th lowest in the nation when it comes to insurance reimbursements for autism care. And that makes it a challenge, he says, to attract medical specialists, leaving families paying